Well, good afternoon, everyone. My name is Sean Egan. I'm the Deputy Director for Labor here in Michigan's Department of Labor, and we're back again for our February webinar regarding workplace mental health. Sometimes we call resilient workplaces. I appreciate you joining us today. We're going to keep this to about a half an hour. You'll see on the top of your screen or bottom of your screen, depending on what you're looking at, a Q&A box. You can type any questions that you have into that Q&A box at any time through the presentation. We're going to try to make sure we have 5 or so minutes or more at the end of the presentation to jump into those. Our communications director, Erica Queeley, is going to moderate those questions for myself and or Danny to make sure that we get us through as many as we can. If you were not able to join us in January for our kickoff webinar, we heard from Rich Mattingly, who is the founder of the Love You Project, and he shared a very challenging story with us about starting the Love You Project as a result of his wife being killed by a coworker. And he started looking into the areas of mental health and kind of feeling his way around, really got focused in on the workplace itself. So he's doing some great work out with Johns Hopkins University. They've launched a school for workplace mental health in their School of Public Health. And they've created a few awards. And one we talked about last month was last year they launched their award for workplace mental health. It's a national project and it's a national award. And they work with Johns Hopkins to evaluate the veracity of those plans, as well as due diligence to see their effectiveness. So they're posting some resources. We have a link on our resource hub that can get you over to some of those resources. Encourage you to check them out. And all of our webinars, including today, will be posted on our resource hub here in Michigan. So if you Google Michigan Workplace Mental Health, you'll get to the Department of Labor, and we have a nice landing page resource hub. Under the events heading, you can find all of these webinars and other information that we're posting. We're going to have a couple of links in the Q&A section for you. Just want to encourage you all to please sign up for our email list. We won't flood your inbox, I promise you, but we do want to make sure that we can get information out on this important topic to people that are paying attention to it. And as an example, we shared out just a couple of days ago, and timely with the events that we're dealing with here in Michigan this week. We were having a great conversation with a group of folks, including large and small employers. And one of the employers said to me, you know, we really appreciate where this is going. We really appreciate the work that you're doing, but I have employees that I can see are struggling right now. What can I do now? And we had an answer. So Michigan developed what we call the Stay Well program for during the COVID pandemic. It's still operational. It's still connected to the coronavirus website and phone numbers, but it's a tool for everybody, and it connects you to counselors as well as community resources to get to those that are struggling. You can find a link to the Stay Well program in the chat, as well as the 988 suicide and crisis line. That was formerly the suicide prevention line that's been changed over to just those 3 digits. And for both of those, just make sure that everybody understands, we say crisis, we say suicide, you don't have to be at that point. If you are struggling, those numbers can connect you to resources that you may need. And there are a lot of great flyers, PDFs, and other things that you can use in your workplace to get that information to your colleagues to make sure that if you see somebody struggling, we can connect them with the tools that they need to do well. In March, currently, we plan to have Dr. Michelle Keys from the University of Michigan Eisenberg Depression Center. She's going to share some findings and some of the work that they're doing in workplaces and give some tips and tools on things that employers could be looking to implement there. Today, just very excited, we have Daniel Schneider, who is the Malcolm Wiener Professor of Social Policy at the Harvard Kennedy School and a Professor of Sociology at the Faculty of Arts and Sciences and co-director of the SHIFT project. We started looking at things when we're doing our workplace mental health work that are in the workplace, things that might be affecting the workplace, and then individual behavioral supports. So we want to look at systems, individuals, society, kind of trauma, and all those other things, and kind of see what's happening in the space. And Danny, as I refer to him, Danny has been working on this concept of predictive scheduling for quite a long time and has done a lot of research, including right here in Michigan, surveying Michigan workers and kind of what's happening for those folks that lack a predictable schedule. So I'm going to turn it over to Danny to share some of his findings, and we'll get to the Q&A after he's finished.
Great. Well, thanks so much, Sean, and Thanks to you and your colleagues, and thanks to everyone for joining us this afternoon. It's great to be with you and have the chance to share some of our work with a group whose work is so impactful for workers and their well-being. I'm a professor, as Sean said, of social policy at the Kennedy School, and my work is really looking at the intersection of jobs and job quality and workers' health, well-being, and economic security. The fundamental idea behind a lot of the work we do is that work is a really important social determinant of health, that the kind of circumstances we encounter on the job really shape our well-being, not just when we're at work, but in all facets of our lives, and that these aspects of job quality matter not just for the workers themselves, but spill over to really shape the well-being of their spouses, of their kids, and can really have, in this sense, multi-generational effects on health and well-being. So we've been doing some work over the past several years as part of the SHIFT project, which is a large-scale ongoing survey focused on service sector workers around the country, including thousands of workers in the state of Michigan. If you'll go to the next slide. This is a group of workers, next slide, thanks a lot. This is a group of workers that makes up a really large part of the labor force in Michigan. About 1 in 7 Michigan workers, according to the Bureau of Labor Statistics, are employed in the service sector. And the service sector here, for our purposes, we're defining pretty narrowly. So that's a large share for workers who are employed in retail establishments, in grocery stores, hardware stores, pharmacies, fast food restaurants, casual dining establishments, or in the delivery and fulfillment sides of the retail economy. Now, we might have a stereotype in mind that many of these workers are, just sort of kids working on the side, maybe looking for a first hand on the occupational ladder. And there certainly are some like that. We'll talk about student workers in this space in a little bit. But I want to emphasize that 3 in 5 Michigan service workers are over the age of 30. 1 in 4 Michigan service sector workers are parents. So to this point about how job quality can shape not just workers' mental well-being, but the well-being of their families, this is a really important channel in the service sector, as so many of these workers are prime age working adults and parents themselves. When we think about job quality, we often think about wages. If you go to the next slide, please. And in the service sector, it's a site of well-known challenges around earning sufficient wages to support a family. The median service sector wage in Michigan in our data is about $14 an hour as of 2022. That's up pretty substantially over the last couple of years, but given inflation in real terms, not quite as much. But even so, it still falls far short of the estimated living wage for Michigan. That is enough money to really support a family above the poverty line in the state of Michigan. And in fact, 77% of the Michigan service sector workers that we surveyed report wages below Michigan's living wage. But just your hourly wage, that's not the full picture of job quality by any means. If you go to the next slide, what we see sort of most directly where wages and other aspects of job quality meet is on having how much work time you get, how many work hours. And so the living wage calculations really assume a worker who's getting 40 hours of work a week. And we often hear a lot about workers who have too much work, professionals who are working all the time, or workers with mandatory overtime. And what we see in the service sector is really a very different picture of amount of work time. Instead, we see workers who struggle with insufficient work hours and continue to struggle with insufficient work hours, even in these recent years coming out of the pandemic. So we see that just 1/3 of workers are working 40 hours or more a week, and that the majority of workers tell us they'd like to work more hours at their jobs, but they're not getting those hours. When we put these two pieces of information together, what share of workers are working less than 35 hours at this job and would like more, we see almost 60% of Michigan service sector workers would like, almost 30% of Michigan service sector workers are involuntary part-time. They would like more hours and they're getting fewer than full-time hours. So the wages remain below a living wage, but compounding that is that folks aren't getting enough hours. If you go to the next slide, there's a third wrinkle. And that third wrinkle is even the hours that workers are getting are far from regular and predictable. For too many service sector workers, the days of a regular 9 to 5 or 8 to 4 shift, or even a regular weekend or evening shift are really long gone. Instead, what we find is that workers have schedules that we characterize as unstable and often unpredictable. They vary from day to day and week to week in the hours they'll work and in how many hours they'll get. And workers often get little advance notice of what these schedules will be. We ask workers, how far in advance do you usually get your work schedule? And what we see is that about 16% of workers are getting their schedules less than 72 hours ahead of when they're going to work. Another 15% are getting it 3 to 6 days. So about a third of workers getting less than a week's notice. Another quarter to a third are getting 1 to 2 weeks notice. Only about 40% of workers are getting more than 2 weeks notice of their schedules that are often quite different from one period to the next. But even once a schedule is posted and published, what workers tell us is that they are often subject to change. A quarter of workers tell us they had at least one on-call work shift in the last month. Now, these are not on-call workers primarily who know that their job is that they'll get called in. These are folks who some of their shifts are being scheduled as on-call, be available to work, but not paid generally if not needed. Other workers have shifts scheduled and then canceled at the last minute, about 16%. Many workers work so-called clopening shifts, where they'll close the store late at night, often make a long commute home, get a few hours of sleep, and then head right back first thing in the morning to open again. And a large majority of workers, almost 2/3, report last-minute changes to the timing of their shift, being sent home early if the store is a bit slow, for instance, or told to stay late if they're needed, to keep staffing the restaurant. So what we see here is the combination of fairly low wages, often insufficient hours, and schedules that, even when posted, are often subject to last-minute change and amendment by managers. If you go to the next slide. Now, what I want to emphasize here is that, there's an important but sometimes difficult to grasp distinction between schedules that are unstable and unpredictable and schedules that are flexible. People often talk about flexible scheduling. And what we really set out to try to understand in this project is that what workers are experiencing? Are they experiencing desirable flexibility, or are they experiencing instability? And one way we can get at that is by asking who sets the schedule? Who decides when you're going to work? Is this because workers want to change their schedule every week and they want to get sent home early, or is that something else? And what we find is that 2/3 of workers tell us that they have to keep their life schedule open and available to work whenever they're needed by their employer. And 2/3 of workers tell us that they would indeed like to have a more stable and predictable schedule. These schedules, by and large, are not flexible from the perspective of workers, but they are flexible for employers. Employers can use these scheduling practices to really keep those payroll costs down. But I think what we realize, and is important to see, is that can have real costs. Maybe not costs for business, although we'll talk about some, but costs for workers' well-being and economic security and that of their families. Next slide, please. Now, what we see is that these practices really continue to be widespread before the pandemic, but all through the pandemic. Even as we held up many service sector workers in grocery stores and delivery trucks and pharmacies as essential, we see that large shares of workers continue to get less than 2 weeks advance notice, to experience shift cancellations, to experience on-call shifts and last-minute timing of their schedules. These practices really remain quite widespread for Michigan service sector workers, even coming out of the pandemic. Next slide. And when we talk to workers and try to understand from them, what is challenging about your job, work schedules really come to the forefront. We see this in some comments from a Burger King worker in Michigan who notes, "I can't shift my schedule according to meet the needs of my life. This schedule isn't flexible. It's really rigid and unstable." A Dollar General worker describes how there's this volatility in the number of hours. I'm going from almost no hours one week to, at the last minute, being asked to work extra hours. Companies are deploying workers to fill in demand as needed, but that leads to real arrhythmia in the family lives and personal lives of workers, as well as in their household finances. The schedule's all over the place, and I'm struggling to get days off for family things. This is the experience of one Panda Express worker, but it's a really widespread experience in the sector, as we'll see. On the next slide, please. So part of what we're trying to do with the Shift Project is, again, sort of understand how work may be a social determinant of mental health and other aspects of health. And there's a couple different pathways by which those kinds of relationships can play out. One is that these kinds of schedules can introduce real work-life conflict in the lives of workers. And we see that in general for service sector workers, large shares of workers tell us that their schedule does not provide enough flexibility to handle family needs, or it's hard to deal with family or personal matters at work, or difficult to get time off. But these kinds of schedules also can lead to real economic volatility. And we know that not having sufficient income to meet your bills and personal responsibilities, let alone put enough food on the table or make rent, can really lead to a serious amount of stress and decreased mental well-being. And we see that in this sample of Michigan workers. 2/3 tell us that they had trouble paying their bills in the past month. So when we put this all together in the next slide, what I'm going to show you are some results from, next slide please, from some regression models. So here we're going to look at the association between having more unstable and unpredictable schedules and some really important aspects of well-being, including experiencing hunger hardship, poor sleep quality, not feeling, a lack of well-being, not feeling happy, and experiencing more psychological distress. What these graphs show you is comparing how workers who have the most stable and predictable schedules, not getting 2 weeks notice, not having last-minute timing changes, not working on call, how those workers fare as compared to their coworkers who experience many more of these sources of instability. And what these highlight really is the important role of scheduling as a determinant of mental health for these essential and important workers. So among workers with the most predictable schedules, just 1 in 5 reported frequent psychological distress. That's still a high number compared to the population. We've got to recognize these are difficult jobs in many ways, but it's almost twice the share among workers who experience the most schedule instability and unpredictability. So here we see the real cost to workers' mental health, to workers' well-being of this kind of schedule instability and unpredictability. Next slide, please. Now, as I mentioned, about 1/4 of workers in the service sector in Michigan are parents of kids. And for parents, these schedules may exact a particular toll, and it may have intergenerational consequences for their children. This is a topic we've looked at quite a bit nationally at the Shift Project, trying to explore, using our data and as well as interviews with parents, just how schedules may matter for family life and child well-being. If you go to the next slide, please. What we see first is that parents are not protected from these unstable and unpredictable scheduling practices. We often think that maybe a parent took a job in the service sector because it is a family-friendly job with hours that could be flexible or reduced. And that's not what we see here. That's not the experience of parent workers in our sample. Instead, they too need to keep their schedules open and available. They too experience last-minute changes to their shifts or less than a week's notice. But in some sense, even though that exposure is pretty similar to their childless coworkers, the consequences can be even more difficult because there is, as we all know, as I well know as a parent of young kids, it's a lot to manage work and children's schedules and routines. And when your own schedule is changing a lot, that instability can really spill over across the generations. In the next slide, please. What we see is that Michigan parents with unpredictable schedules really suffer as a result. That 80% of parents with the least predictable schedules report poor sleep quality. Half are reporting experiencing hunger hardship, not enough to eat because they couldn't afford it in the last month. And large shares are experiencing psychological distress and unhappiness. These are sobering results, but I don't think they should strike us as surprising. And they, as a parent, being able to establish routines and count on stable childcare, bedtimes, pickup times is crucial. And these kinds of unstable and unpredictable schedules really undermine the ability of many parents to set up those kinds of routines and rely on that kind of rhythm of family life. In our work, we've shown how parental exposure to unstable schedules spills over to lead to more internalizing and externalizing behavior among kids, how it makes setting up childcare for very young children almost impossible. And such kids whose parents have unstable schedules are far less likely to be in formal care and are far more likely to have multiple sources of childcare and informal childcare. And so we really see here the kind of long reach of these workplace practices for workers' well-being and that of their kids. Next slide, please. We've also done some work looking at students. We certainly have the idea that many students may be employed part-time in the service sector, and we do see that about 1/3 of our workers are enrolled in school, most of them pursuing higher education. And so in this sense, you could imagine a real complementarity, that a service sector job may be the source of income you need as you pursue higher education as a way to get ahead and get another hand on the career ladder. But in the next slide, what we see is that many students report to us that their schedules get in the way, that student workers experience lots of on-call shifts, lots of last-minute changes, canceled shifts, and clopening shifts. Again, these aren't flexible jobs that accommodate school. Instead, almost half of student workers tell us that their work schedule makes it more difficult for them to study and attend class. So in this sense, it's not so much a complement to this mobility project, but can be a real constraint on students' ability to do well in school, to get ahead. Next slide, please. So what can we do about this? Well, I think there's a couple different ways to think about it. And one way to think about it is that while unstable and unpredictable scheduling practices are prevalent in Michigan in the service sector, they're not universal. So if 40% of workers are getting less than 2 weeks notice, 60% of workers are getting 2 weeks notice. And what we found in our data is that there are many employers across the country that have found a way to profitably do business without using such unstable and unpredictable scheduling practices. Companies like Costco and Trader Joe's, In-N-Out Burger, and many others have adopted more stable and predictable scheduling practices. A set of research on firms finds that these practices may be good not just for workers' mental health, but for businesses with less turnover and even higher productivity when more stable schedules are introduced. But not all firms are doing this. And so there's a real role here for public policy to raise the floor on job quality and also to ensure a more level playing field across these sets of employers, right? That people can't sort of like just scoot around the system and have really unstable practices that might help their bottom line in the very short term, but really harm workers and others as other firms try to do the right thing. And so we have studied in detail one of these laws, Seattle's Secure Scheduling Law, which went into effect back in 2017. And we've collected data in Seattle from Seattle workers and workers in other comparison places to try to estimate what effect did Seattle's law have. And what Seattle's law required was 2 weeks advance notice of work schedules and then some modest predictability payments, kind of in the mode of overtime pay, if you will, when employers change schedules at the last minute. And as you'll see in the next slide, what we found is that the Seattle law, even 2 years after implementation, had some very real effects on promoting schedule stability and predictability for workers. The share of workers in Seattle in the green lines over time who got less than 2 weeks notice significantly decreased. The share of workers experiencing last-minute shift changes, especially shift changes without some compensatory pay, went down significantly. And we even saw some reductions in clopening shifts and on-call shifts for Seattle workers. In the next slide, what you'll see is that these changes had real consequences for workers' mental health and well-being. That in Seattle, one effect of the law is that service sector workers reported, as a consequence, being happier. They reported better sleep, and they even reported less material hardship. So these laws have real effects. Now, not every employer has complied with the law. That's an ongoing process of labor implementation and enforcement and regulation. But even with these preliminary changes over just the first 2 years of the law's implementation, we saw really significant increases in schedule stability. And then what we would expect, follow-on consequences in improvements in workers' mental health and well-being. So let me stop there, and I'll put the last slide if you don't mind. And I really look forward to talking with you all about this work and answering any questions you may have. Thank you.
Thanks so much, Danny. You've mentioned the phrase clopening a few times. I think you said what it was quite quickly. Would you mind just kind of giving a slowed down version of what that means for everybody that's watching?
Yeah, absolutely. A clopening is a shift where you close and then you're immediately scheduled to open. And if you close at 5 p.m. and then your store opens at 10 a.m. the next day, that's not so bad. That's what many of us work, right? Or 9 a.m. But if you work in a food service establishment or a pharmacy or many retail establishments that are open really late, and then you close even after that, and then you're back first thing in the morning, this is a scheduling practice that can really be quite detrimental to workers' well-being. It's not like working a night shift. It's like working a really truncated, two shifts really close together. You're not paid in between, but the time is so short that it's not really useful. In some sense, it's harmful for workers' well-being. I suggest everyone search the hashtag Clopen on Twitter. You'll see many workers sharing their frustrations with these kinds of shifts.
Yeah, I appreciate that. I was recently looking at some OSHA information on fatigue and how that impacts workplace safety and health, and that fatigue concept, just some quick data that was in one of their publications, that accident and injury rates are 18% greater during evening hours, 30% greater during night shifts, and those working 12 hours per day is associated with a 37% increase in risk of injury. So I think to that point of the clopening concept, uh, you would see that fall in there, right? There would be likely fatigue, the poor sleep quality. But I think that's great information. I really appreciate you taking the time with this. Erica, do we have any questions that you'd like to get to?
We do. And the first question from Morgan is, will we be able to get a copy of the slides or data from Daniel's presentation?
Yeah, absolutely. You know, what I would do is right now, what you can do is find much of this information in a report that we put out just a couple days ago on the conditions around scheduling that Michigan service sector workers face. It's up on our website at, and I think we could probably share it in the chat, but at shift.hks.harvard.edu. And in addition to the report, which really mirrors a lot of what we talked about today, we've got a big evidence base up there on how work schedules are shaping the mental health of workers and their well-being more generally, drawing on our research in a series of briefs and academic articles.
All right, thank you. I'll just add to that too. Up above in our published Q&A is a link to sign up for our email updates, and so we can make sure that you get a recording of this webinar and all the details that were shared. So be sure to click that link and sign up, as Sean mentioned. All right, and our next question is, does the living wage assume a certain number of hours per week as well?
Yeah, no, it's a great point. And the living wage calculation, it does. It assumes that you're working full time. And as we discussed, that's really not the reality for service sector workers at many of these firms. And so I think in some sense, it understates the challenge that many service sector workers are facing when it comes to making ends meet.
Yeah, and you'll see Michigan and a lot of other states in our prosperity group, we use what's called the ALICE rate. And that's a rate that's established through the United Way and a bunch of research that brings in other costs like transportation, childcare, healthcare, cost of living, and things like that. So you can kind of compare that as well. You'll find that on our Michigan Leo website as well, to kind of look at a survival budget. What a survival budget looks like and where people need to be.
Right. It looks like we have time for at least one more. Are you aware of any changes in staffing issues or turnover effects from the Seattle law, or even the stability of shifts and scheduling?
Yeah, no, thanks for this question. What we've seen in sort of a number, not from Seattle specifically, but in a number of studies that look at work scheduling and turnover, is that there appears to be a pretty strong relationship where workers experience work-life conflict, job dissatisfaction, and economic insecurity as a result of unstable schedules, and that seems to then in turn lead to more turnover. So we've done that using some panel data we've collected from workers. We see much higher rates of turnover among workers who experience more schedule instability. We also see it in a set of studies that have been done at single firms using really fine-grained, high-quality internal firm data, right? So, merging data from time clocks and scheduling software systems and personnel records. And these studies in the hospitality industry and healthcare find a really strong link between unstable schedules and turnover. And then the last piece of evidence comes from a really excellent randomized controlled trial done at the Gap, which rolled out a set of more stable and predictable scheduling practices at some stores and not others. And a year on, it does find reductions in turnover, especially from our senior employees. But perhaps most notably, it finds increases in year-over-year same-store sales. And part of that mechanism is the ability to retain the most senior and most highly skilled associates because schedules improved.
All right. Well, we are out of time, so I thank you for getting to the questions that we could squeeze in. Sean, any closing words for us?
I just want to thank Danny for participating, the work that they did looking at Michigan, focusing on Michigan working people, so we get a nice snapshot. It's very hard in the work we're doing to find Michigan specific data. So this was a great opportunity for us to kind of highlight some challenges that we're seeing out there and how they impact workplace health and well-being, as well as potentially children and family well-being. And I think this is great information, a great conversation starter, and I appreciate you all attending. And our plan is the third Thursday at 2 p.m. So if you want to lock in your calendars, we're going to do that the best that we can, but it's we're focused on quality over quantity. So we're going to work with great people like Danny, and if we need to move it around, we might. Please make sure you sign up for our emails, and I appreciate you all attending today. Thank you so much.
Thank you all.